Dr. Tom Berger. Tom Berger is a life member of the Vietnam Veterans of America and founding member of VA Chapter 317 in Kansas City, Missouri. Dr. Berger served as a Navy corpsman with the 3rd Marine Corps Division in Vietnam during 1966 to 1968. Following his military service and upon the subsequent completion of his postdoctoral studies, he's held faculty, research, and administrative appointments at the University of Kansas in Lawrence, the State University System of Florida in Tallahassee, and the University of Missouri Columbia, as well as program administrator positions with the Illinois Easter Seal Society and United Cerebral Palsy. After serving as chair of VA's National PTSD and Substance Abuse Committee for almost a decade, he joined the staff of the VA National Office as Senior Policy Analyst for Veterans Benefit and Mental Health Issues in 2008. Then in June 2009, he was appointed Executive Director of the VA Veterans Health Council. His primary mission is to improve the health care of America's veterans through education and information. Please welcome Dr. Tom Berger.
Good afternoon, ladies and gentlemen. It is indeed an honor to be here, and I bring the best wishes of our President and elected board for Vietnam Veterans of America, and a special welcome to all the veterans, including our Canadian brothers and sisters, along with our Laotian brothers and sisters. So, I want to tell you about a couple of things that are going on in Washington. First of all, it looks like there's going to be a vote this week on our toxic exposures bill, the one that you've all been working hard, that will set up research on our kids and our grandkids as a result of our exposure to Agent Orange and other toxic chemicals. They were supposed to vote on it this past week, but it was pulled out and added to the Fairness for Veterans Act, which is a mental health bill. So that's the good news. The bad news is that there is a report going to be issued later this month by a group called the Commission on Care. This group was put together on the basis of the legislation that created the Choice Act. The problem is, this Commission on Care is going to call for the abolition of the VA hospital system. Not one of the people that serve on the Commission, with one sole exception, is a United States veteran, much less none of them have ever visited a VA hospital. We cannot allow this to happen. So we're hard at work to combat this idea. More good news. As you know, one of the greatest illnesses affecting our Vietnam veterans in particular is hepatitis C. We've made great strides in the past year, both in terms of legislation and policy. First, you know there are now at least 3 cures, not just treatments, but cures for hepatitis C. Secondly, through the efforts of Vietnam Veterans of America and the Health Council, we were able to get $1.5 billion, that's with a B, ladies and gentlemen, $1.5 billion for the treatment of hepatitis C in the VA. They can't hire any personnel, and they can't buy any equipment with that money. And it's guaranteed for the next 2 years. Only spent on the treatments. That's the good news. We hope that you will get tested for Hep C, because oftentimes it doesn't show up for decades. And if you were exposed to any blood or bodily fluids. While you are in the service, get tested, get screened for Hep C. Please, I beg you. Last but not least, I want to walk over here and get something out of my briefcase. I'd like to make a special presentation to the president of Chapter 5. Mike, if you'll come over here, please. VVA National wants to recognize the contributions that Chapter 5 has made throughout its 36 years of existence to not only veterans, their families, but to the community. So on behalf of our President John Rowan, I want to present this certificate in recognition of this service and honor. Thank you, Mike. And last but not least, welcome home. And you folks out there represent our founding principle. Never again shall one generation of American veterans abandon another. Thank you.
Thank you, Dr. Berger.